It was mid-1970s. Leslie and John Brown, a Bristol-based couple, were childless even after 9 years of marriage. After visiting scores of doctors, they finally approached Dr. Patrick Steptoe and Dr. Robert Edwards. As an experiment, they would help the couple bear a child. Dr. Steptoe extracted an egg from Leslie. The egg was then mixed with John's sperm for fertilization. The fertilized egg was then placed in a special solution and allowed to divide into 64 cells. The fertilized egg, now an embryo, was placed into Leslie's uterus. 9 months later, on July 25, 1978, Leslie delivered Louise Brown, the world's first test tube baby. Louise's birth was considered a medical triumph and provided hope to many infertile couples. Couples who are unable to conceive or produce children even after 2 years of unprotected sexual cohabitation. Infertility can be caused by many factors, including physical and congenital reasons, sexually transmitted diseases, drugs, immunological or even psychological, and lifestyle factors. To treat infertility, couples are often advised to visit infertility clinics, where the doctors evaluate both partners to pinpoint the causes of infertility. Based on the results, the doctors may then suggest medication or surgery. For instance, if a blocked fallopian tube is preventing the woman from conceiving, then the doctor will suggest surgery to unblock it. However, when surgeries or medications fail, doctors may suggest assisted reproductive technologies or ART. ART is a collective term used for clinical procedures that are designed to help achieve pregnancy by allowing the egg and sperm to meet in an artificial environment, usually a laboratory. Today, there are several types of ART available for infertile couples, including in vitro fertilization, intrauterine transfer, zygote intrafallopian transfer, gamete intrafallopian transfer, intracytoplasmic sperm injection, and artificial insemination. In vitro fertilization, or IVF, which was used to treat Leslie Brown, is a process in which the egg is fertilized by the sperm outside the woman's body and under simulated conditions created in a laboratory. IVF is also called a test tube baby program. Interestingly, the gametes can be collected from the partner or a donor. Once the egg and sperm are collected, they are placed in a dish for fertilization and incubated together to form an embryo. IVF is followed by embryo transfer or ET, where the embryo is transferred to the uterus using a tube called a catheter. Apart from IVF, couples can also opt for intrauterine transfer or IUT. In this method, embryos formed by fusion of gametes inside a healthy woman's body, or in vivo fertilization, are removed through surgery and transferred into the uterus of the woman who wishes to conceive. Another option available for infertile couples is zygote intrafallopian transfer, or ZIFT. This process is similar to IVF, where the gametes are collected and the egg is fertilized in the lab. Post-fertilization. When the zygote contains more than 8 blastomeres, the doctors create a small incision in the abdomen using a fiber-thin tube called a laparoscope. The zygotes are then transferred to the fallopian tube through the laparoscope. Interestingly, a laparoscope is also used in another ART called gamete intrafallopian transfer, or GIFT, in which a healthy egg from a donor is placed inside the fallopian tube of the woman who wishes to conceive. GIFT is performed when the female partner has a non-functioning ovary, but her uterus and fallopian tubes are in a healthy condition and capable of providing a conducive environment for fertilization and fetal development. Did you know that at times, a woman may not be able to conceive because of male infertility resulting from low sperm count, low sperm motility, a damaged or missing vas deferens, or the inability to inseminate? In such cases, the couple can opt for intracytoplasmic sperm injection, or ICSI, in which the doctor injects a single sperm into each ovum, which leads to fertilization. Post-fertilization, the fertilized egg divides to form an embryo, which is planted inside the uterus using a catheter. Apart from ICSI, artificial insemination is another option in which semen, collected from either the male partner or a donor, is introduced into the vagina or uterus by inserting a catheter. Hence, artificial insemination is also called intrauterine insemination, or IUI. Artificial insemination, as well as other ARTs, are helping infertile couples realize their dream of becoming parents. However, one should remember that these methods are expensive, as they require highly qualified doctors as well as expensive instruments.